Hi, everyone. On today's podcast, we're going to talk about the evidence on doulas. Hi, everyone, and welcome to today's episode of the Evidence-Based Birth Podcast. My name is Dr. Rebecca Dekker, pronouns she, her, and I'll be your co-host for today's episode. Today, along with co-host Sara Ailshire, we are excited to bring some brand new evidence-based information to you all about the evidence on doulas. As a quick content note, we will talking about the impact of racism on birth outcomes, as well as homophobia and transphobia, birth trauma, and obstetric violence. Today with me, I have Sara Ailshire. Sara, pronouns she, her, is a doctoral candidate in anthropology and an evidence-based birth research fellow in her second year here at EBB. Sara, we're so excited to have you here.
Thank you so much. I'm especially excited to be talking with you today about doulas because in addition to my work here at EBB, my own academic research has in part focused on the efforts of birth practitioners like doulas to improve people's experiences in childbirth. I've had the privilege to learn a lot from doulas over the years, and I hope I'm doing their legacy of mentorship proud when I'm doing work here at EBB.
So, Sara, you came on the team in 2023, and you've been very busy the past year. You worked with us on nitrous, prom, P-prom, or preterm prom, and skin to skin after cesarean. You also did the year in review podcast with us. So now we're moving on to talk about the evidence on doulas, which is a project that you helped with along with Ihotu Ali. And we had never published a podcast episode focusing on the evidence on doulas. So for all of you listening, this is the first one. We've had lots of doulas interviewed on the podcast, but we've never done an overview of the evidence on doulas. However, we have had a signature article on the evidence on doulas that was published in 2013, updated in 2017 and 2019. And so today's episode is celebrating the 2024 update of our signature article on doulas, which is now available at the Evidence-Based Birth website. Just go to ebbirth.com/doulas, and you can download a free one-page handout on this topic that is easily downloadable at the top of the page. So this doula article update is a project we started working on in 2023, and it was co-authored by Sara, myself, and Ihotu Ali, who is a doctoral student with her MPH, who also contributed substantially to this article. So our goal with this article is to write it both for people who may be interested in hiring a doula and also for doulas themselves or people who might be interested in becoming a doula. It has a really broad scope. In this article on doulas, we cover what a doula is, what are the benefits of having a doula, how is having a doula present at birth different from having your spouse or partner's companionship, why doulas are so effective, what are some of the newer research finding on doulas, what do the professional guidelines say from midwives and doctors about doulas, and of course, we always end by talking about what is the bottom line on the evidence on doulas. So, Sara, I would love for you to kick us off and start off by explaining what a doula is.
Sure. So a doula is a special companion who supports you in labor and birth. In general, doulas are trained to provide continuous one-on-one care. They provide physical support and emotional support during labor. Doulas can also provide informational support to new parents and expecting families. They can give some general guidance about, information about childbirth, things that they could expect to see in the hospital, just kind of preparing people for what birth could look like. Doulas can also be a source of advocacy during and after birth. Finally, a lot of people will receive some follow-up care after they've had their baby from their doula. They'll maybe meet with them one time and reflect on the experience and get some guidance. There's lots of different types of doulas, though, and there's lots of different types of trainings and certifications, traditional practices, and perspectives on doula care. An anthropologist by the name of Dr. Dana Raphael is the person who kind of coined the term doula to describe labor companions. She first did this in her dissertation all the way back in 1966, but she really popularized the term and kind of brought it into the mainstream through a book that she published in 1973 called The Tender Gift, Breastfeeding. However, birth companions have been present in all cultures and across all time periods. Modern doulas today may be carrying on this legacy of companionship and support, but they didn't invent it, and it didn't start, in America in the 1960s. The use of the term doula is newer, but this concept of birth work is deeply rooted in human history.
Yeah, and before we go any further, I want to share a quick note about the term doula. So in this article, in this podcast, we use that term because it's the most widely used word to describe birth companionship and support. However, there are other words that may be used for this role. You may see the term birth worker, birth sister, perinatal community health worker, among others. And we have seen that some birth workers reject the term doula because of its history of meaning slave or servant in Greek culture. Others feel that the term doula does not address the whole of their work, or that other words might make more sense to their communities. So while we're using the term doula and while we're focusing on the research on doulas, please note that birth companionship does not begin or end with this terminology. I also want to point out that in many countries, the role of a traditional birth attendant, a midwife, and a doula are considered distinct roles from one another. However, the separation of these roles is a relatively recent development in history. So, for those of you who are not aware, a traditional birth attendant or traditional midwife may refer to birth companions who attend births and catch babies, but they do not have legal status within their state or country as a licensed midwife. And traditional birth attendants are continuing the ancient tradition of supporting birthing people, either from family members who've given birth previously or a member of the community who has a specialized expertise in birth work. And in some cultures, there's other special words for these birth practitioners, such as dai, grand midwife, comadrona, and more. So we also have midwives who practice in medical settings and different types of midwives with different scopes of practice, training, or licensure. And so although today people consider these traditional birth attendants, midwives, and doulas to be distinct, we want to point out these lines were blurred in the past and still are in some places. And another note before we dive deeper into the evidence on doulas is that here at Evidence-Based Birth, we recognize that the late 1900s movement to train and certify doulas was initially led by white doula trainers who worked to, quote unquote, professionalize these birthing practices that had been preserved across cultures by Black, Brown, and Indigenous women. And some of these organizations claimed superiority in their field. They appropriated from and failed to credit the ancestral skills and cultural knowledge preserved by these Indigenous, Black, and Brown communities around the world. And the problems in doula work have been similar to the problems of the North American women's health movement, which is a collective name for feminist activist efforts in reproduction. But today, there are many programs all around the world that are training and certifying doulas. A growing number of doula organizations in the United States are led by people of color, and some traditionally white-led doula organizations have taken steps to address racism and promote diversity within their organizations, but the work is ongoing. It's a work in progress. So, Sara, take us back, as we start going into the research. I think it might be helpful to know some of the terms about the different types of doulas. So can you walk us through the different types that are available?
Yeah, absolutely. And these are just sort of like a sampling of common types of doulas you might see. Like in addition to somebody who describes themselves as a doula, they may have additional training or additional experience in these elements of doula care. Because it's a really, it's a broad, it's a big umbrella, it's a big tent. So community-based doulas are doulas who are, who have doula skills, who come from the same communities as their clients. They may oftentimes develop really close relationships with their clients. They may know them already or have a social connection to them. And in addition to providing them with birth support, they may also assist them in getting signed up for, beneficial programs. They might help them address like other issues that they're facing in their lives or in their relationships. They can really offer wraparound care for the people that they're supporting in birth and pregnancy. And in some cases, community-based doulas may have really long-lasting relationships with their clients. Like it doesn't just sort of start and stop after their client has given birth. Postpartum doulas are doulas who are trained to provide support to birthing people and their families in the weeks following birth. So they provide families with support and information about infant care and feeding, soothing. If it's their first baby, they might be, there to kind of help people ease into that role. And that can include not just the birthing person, but their partner. If it's a family that already has children, they may also provide support to, siblings as they adapt to this new family member. Some postpartum doulas will also provide care to new families by assisting with light household tasks. They may help provide nutritious foods. They can do a variety of things for people in the weeks following birth. Full spectrum doulas are doulas who provide support before, during, and after pregnancy. This can include support during and after abortion care. End-of-life doulas, who are sometimes called death doulas colloquially, are people who are trained in some of the ethos of being a doula, of being a present, knowledgeable, supportive companion. But instead of accompanying people around the beginning stages of life, they're accompanying them as they leave this life and enter what comes next. And they provide support not only to a dying person, but again, to their community, to their family. Loss and bereavement doulas are doulas who specialize in providing support to childbearing families who have experienced a miscarriage, a fatal fetal diagnosis, a stillbirth, or an infant loss. And in episode 195, I think, Rebecca, you spoke with a full spectrum doula who also offered loss and bereavement doula care services, right?
Yeah. And I also think one of the doulas you mentioned, I want to clarify the community-based doulas. Sometimes people say, well, I practice in my community, so I'm a community-based doula. But that is a special term reserved typically for doulas who are from the same marginalized group as their clients. Not anybody can call themselves a community-based doula, if that makes sense. I think the people that typically we have hired in the past as doulas, you might think of as more of, some people call them a traditional, but I would say a better word might be like a typical doula that's gone through a typical training and provides several prenatal visits, the birth support, and one postpartum visit. That would be like more typical. And the community-based doula is a much more in-depth, broad-ranging support.
Yeah, absolutely. And a lot of, I think, community-based doulas, too, will work with organizations or work with other community-based doulas to provide care, within their community. Is that right?
Right. Yeah, exactly.
Yeah.
And somebody could practice in both methods as well. They might have a more typical standard practice and then also do community-based work as well. So we often see some people will be doing this typical birth doula. They may be a postpartum doula. So people can have more than one role as well.
Yeah, absolutely. And that's the thing that is so interesting. Doulas can do a lot of different things and develop these trainings over time. But I thought it might also be helpful to talk about what doulas are not.
Mm-hmm.
I think sometimes people can be a little bit confused about, what is the role of a doula and how is a doula distinct from other types of birth professionals, other types of medical practitioners, things like that. Well, for starters, doulas are not nurses and they're not medical professionals. And having a doula present with you when you're giving birth is very distinct from having a chosen companion like your partner, a relative, or a friend providing you labor support. Doulas do not perform clinical tasks like cervical exams or fetal heart monitoring. They're not supposed to give medical advice or give you a diagnosis. They might say, hey, that sounds serious. You should talk to your midwife. You should talk to your OB. But they're not going to be able to tell you, oh, you definitely have this, or this. Doulas do not make decisions for you. Doulas can help you evaluate your options, can help you through the decision-making process. But ultimately, the role of a doula is support, not deciding for somebody. They're not supposed to pressure you into adhering to their preferences or their choices. They do not take over for the partner. A lot of partners find that doulas are supporting them almost as much as they're supporting the birthing person. They can really benefit from that relationship. But doulas don't take over. They don't catch the baby. And in general, doulas don't change shifts. So most of the time when you have a doula will be with you during labor and birth. In some cases, doulas may call in backup if birth goes on or labor goes on for a long time. Or if you're giving birth in a hospital and there's volunteer doulas or doulas who are working through the hospital, that might be a case where you see a doula shift change. But in general, a doula is kind of assigned to you and sticks with you throughout the process. We talked about this a little bit already, but in addition to all different types of doulas, there's also a lot of different types of doula trainings that people can pursue. And there's different philosophies about how to become a doula in the first place. So something that we wanted to do in the article was we wanted to share some information that clarifies the different pathways that people take to becoming a doula, not only to benefit people who are interested in working with doulas, but ideally to support people who are interested in taking on this work, who might want to become a doula themselves. We also thought this information could be really helpful for those who are interested in hiring a doula and are trying to explain maybe to their partner or to their family members who this person is and what they do, and how are they qualified to support you in this life experience. Some other things that we added to the article was we were able to expand a little bit on the types of support that doulas provide. So we talked a little bit about the 4 pillars of labor support. We introduced a little bit more information about the types of physical support, emotional support, informational support, and advocacy support that doulas can offer. And we did that because we really wanted to emphasize, again, a big variety of doulas, big variety of doula trainings, a lot of different ways of thinking about how to approach birth, how to be a doula. We want to support doulas and clients in finding the right match, finding somebody whose expectations are going to align, in the best possible way with the doula that they're going to work with. Not all doulas approach things the same way. And it's really important that both people feel respected, heard, and feel it's a good fit for one another. So to help facilitate this, we also developed an interview guide that we include at the end of the signature article that prospective clients can use when they're interviewing different doulas, and that maybe doulas could use with their clients to kind of help structure these conversations around, what are your expectations? What are your needs? And how does that align with the professional services that doulas offer? Just to ensure that everybody leaves the birth experience feeling satisfied and respected.
Yeah, I want to congratulate you on helping create that interview guide. That was I think a really helpful addition to the end of the article. And I also wanted to give a couple of examples, if it's okay, of the different types of support. So with physical support, we give a bunch of examples, but this could include creating a calm environment, such as dimming lights, arranging curtains, applying warmth or cold packs, holding your hand, keeping eye contact with you if that is helpful, guiding you with positions, swaying, movement, using a birth ball or peanut ball. And in low resource settings, doulas may alert the staff if you have unusual symptoms that they're not addressing. They may offer interpretation support if there is a low resourced area and you're not getting the interpretation you need. Emotional support with helping you feel more in control, more confident, showing a caring attitude, mirroring back to you the emotions and feelings you're having, showing just complete acceptance of your wishes, debriefing after the birth and really listening to you with empathy. A lot of doulas we know love evidence-based birth because they use our materials to help educate you. So they are working on helping find evidence-based information about different options. They're pretty good at being able to explain common medical procedures and help you with communication. And of course, the more controversial aspect of doula support is advocacy support, which we define as supporting the birthing person in their right to make decisions about their own body and baby. And this is a bit controversial. We go into the background of this subject and we give some examples of subtle advocacy that I think most doulas would feel comfortable using, such as asking you what you want in front of your care team, encouraging you to ask questions, verbally supporting your decisions, helping facilitate communication. But we also give examples of more direct advocacy techniques, such as amplifying your voice if you're being dismissed, ignored, or not heard. For example, a doula could say, "Excuse me," they're trying to tell you something. I wasn't sure if you heard them or not. They could say that to the provider. They could fill communication gaps. They could ask to speak with a nurse in the hallway, let them know that something is triggering for you if you're a survivor. Informing the nurse or physician, you really need to get an interpreter. reminding the care team of your wishes and alerting the care team to concerning signs or symptoms, such as excessive blood loss or signs of preeclampsia. So I hope I didn't go too far off track, but I think it was important to mention that you can go straight to the article and find just all these examples of ways doulas support families, and it's so invaluable.
No, absolutely. I think it's really helpful to have those examples, just so if you've never given birth before, never worked with a doula before, you can also kind of imagine, okay, like what would be useful for me? Like which of these would work?
Right.
And also I think just gives everybody an appreciation for the incredible support and care that doulas offer to birthing people in all sorts of different dimensions. So Rebecca, I wanted to ask you if you wouldn't mind sharing a little bit about what does the evidence show about the benefits of having a doula?
Yeah. So I want to share 3 studies with you all. So the first one is a Cochrane review by Boren et al., published in 2017. This combined the results of 26 randomized controlled trials with more than 15,000 participants across 17 countries all over the world in both high-income and middle-income settings. And so people in these studies were randomly assigned, like flipping a coin, to either receive continuous one-on-one labor support or usual care. One of the things that I think is important to keep in mind is because these were randomized trials, you have equal numbers in both the doula group and the usual care group of people who desire an unmedicated birth or have certain preferences for their birth. So that controls for differences in the population. That's why we do randomized control trials. I think some people get confused because they're like, well, the doula results are better because people wanted to work with a doula, but that's not the case. It's like flipping a coin. You don't get to control in these studies if you have a doula or not. And in this review, it wasn't just doulas. Continuous support can also be provided by other hospital staff, such as a midwife or a nurse, or a companion from the family's social network. In 15 of these studies, the birthing person's partner was not allowed to be present at the birth at all. And unfortunately, that is still something that happens in parts of the world, especially areas where you have no privacy, so they can't let male companions into the labor ward. In the other 11 studies, the partner was allowed to be present, in addition, if they were assigned to somebody else for labor support. Overall, they found that those who received continuous labor support were more likely to have spontaneous vaginal births, less likely to need pain medication, less likely to have epidurals, less likely to have negative feelings about their birth, and less likely to have vacuum or forceps assistance or cesareans. In addition, their labors were shorter by about 40 minutes on average, and their babies were less likely to have low APGAR scores at birth. An APGAR score is a measure of the baby's immediate health at birth. There was also some evidence that doula support in labor lowered rates of postpartum depression afterwards, and they found no evidence that there were any risks to doula support. So it was a risk-free intervention that improved health outcomes. And they found that overall doulas are safe and beneficial. Now, they also looked to see how, if the type of support made a difference. So does it matter who is there with you providing continuous labor support? Does a midwife, a doula, a partner, a friend, or relative offer more benefit? And they were able to look at this question for 6 topics: use of any pain medication, use of Pitocin during labor, a spontaneous vaginal birth, which means a vaginal birth that happens on its own without forceps or vacuum, cesarean rates, admission to the special care nursery after birth, and negative birth experiences. So the researchers found that for 2 of the health outcomes, the best results occurred when someone had continuous labor support from a trained doula. So this person was not a staff member at the hospital and they were not part of the client's social network. And the researchers found that overall, continuous support during birth led to a 25% decrease in the risk of cesarean. And the largest effect was seen with a doula, a 39% decrease in the risk of cesarean, an 8% increase in the likelihood of spontaneous vaginal birth. And the largest effect was seen with a doula, that was a 15% increase, a 10% decrease in the use of any medicines for pain relief, shorter labors by 41 minutes on average, a 38% decrease in the baby's risk of a low 5-minute APGAR score, and a 31% decrease in the risk of being dissatisfied with the birth experience. Basically, they're finding that continuous labor support is important and beneficial, and we can make at least 2 of these outcomes even better if you have labor support from a trained doula. In a later Cochrane review that was published in 2019, also by Boren et al., this was looking more qualitatively at women's experiences during childbirth. So they found 51 studies, mainly from high-income countries, and they found that having a labor companion positively influenced the dynamic between birthing families and their healthcare providers. They found that the presence of a labor companion helped protect women from mistreatment in childbirth and improved health outcomes because the labor companions noticed and called attention to potential complications throughout labor and birth. They also found that most people in the studies wanted and benefited from the presence of a labor companion, whether it was a trained doula or a family member, partner, or friend. And then the third study I'm going to talk about is a 2022 systematic review where researchers combined 9 studies with nearly 7,000 participants, and they were exploring the benefits of having a female relative act as a lay doula. So a lay doula would mean somebody who has not been formally trained as a doula, but they're kind of acting in that role. And, we've had people on the podcast come on and talk about, my mom acted like my doula, or my sister acted like my doula. So the results from this study showed that birthing people consistently reported positive birth experiences when their female relatives served as lay doulas. However, the lay doula's impact on the cesarean risk and the length of labor was inconsistent. Some studies showed that lay doulas had a positive impact on these things. Others found no difference. But overall, the review found that positive benefits of continuous labor support are most beneficial if you also have a formally trained doula with you who is not hired by the hospital. And that's where you get the benefit of lowering the cesarean rate. So, Sara, I talked a little bit about the lay doulas. Can you go into more depth and talk about how having a trained doula at your birth would be different from having your spouse or a partner's companionship?
Yeah, absolutely. So some people think that they hear about doulas and like, well, why would I need that? My partner is going to be there for me. My friend's going to be there. I'm going to have the person who is closest to me present. And it's true that having your chosen labor companion with you is essential, and it's really beneficial for you to have that person by your side. But that person is also going to need to do things. They're going to eat, and they might use bathroom. And more than that, they might just need support in their own emotional journey. They might become overwhelmed, especially if if they've never seen a birth before, or, if you're moving through labor and you're maybe vocalizing a lot and they're distressed because they think you're distressed, they just might not know what's going on. So having a person who has training and experience, who's knowledgeable about childbirth, can be really, really beneficial. Having somebody there who has knowledge about common medical procedures, if you're in a hospital setting, what is normal? What goes on there? And doulas are people who have this knowledge and who have this experience. And they will use that not only to support the birthing person, but to support and inform their labor companion, their partner. So that's a really important distinction. Basically, a doula can provide the experience, provide the knowledge, provide the guidance through the emotional aspects of birth in order to kind of not only support the birthing person, but to support the birthing companion in supporting the birthing person. Doulas can educate partners not only about birth, but they can also educate them about how to advocate for their spouse or for their friend. And they can work together with partners to kind of make up a labor support team. Research has shown, so I'm going to talk a little bit here about fathers in particular, but research has shown that the most positive birth experiences for fathers were ones where they had continuous support from either a doula or a midwife. In these research studies, these fathers reported that they really benefited from having a person who had the time to explain things to them, who could answer their questions, who could help guide them in supporting their spouse or their partner. And also by being there and allowing them to kind of take breaks when the emotional intensity of labor was getting to them. It made them feel okay that they could take care of themselves and not feel like they were abandoning, their partner, because they're a human too. This is new for them. So yeah, a lot of fathers in the research about doulas and their impact on labor companions really feel that they benefit from having another person there. It's a source of knowledge, information, advocacy, and reassurance. Doulas are also really important for people who are choosing to be single parents, as well as for birthing people who are unable to have their partner or their labor companion of choice present. In EBB Podcast 114, we spoke to a solo parent about her birth story and the role that her doula played for her. And in a more recent episode 303, a military spouse shared about how her doula supported her while her partner was deployed. So sometimes things happen. You can be in a situation where your chosen birth companion just isn't available, or you could be choosing to enter parenthood solo. And a doula can be a really important source of reassurance for, of course, the birthing person, but also for members of their community, their family, their friends, who will feel, confident and feel assured that, this person is getting the support that they need in the context and the situation in which they're having their child.
Yeah, so important. I think doulas play a really critical role around the world, helping ensure that these kinds of parents hopefully don't birth alone. So super important role that they're doing. Sara, what about nurses? So you've talked about how having a doula is different than a partner's presence. How is having a doula different from having a labor and delivery nurse with you?
Absolutely. So the primary task of a labor and delivery nurse is to provide clinical care, right? They are licensed medical professionals. Like they can, do medical procedures. They have that medical expertise. They form part of your medical care team along with a midwife or with an OB, right? That doesn't mean that they don't provide labor support. A lot of labor and delivery nurses do. However, labor and delivery nurses are doing a lot more than just hanging out with one person throughout their entire, labor and birth. They have to take care of other patients. They have other responsibilities while they're on shift, and they can't sit there and spend the entire time that you're in labor in the room with you. Depending on when you go into labor and if you're giving birth in a hospital, when you arrive on the delivery ward, you might be there for a shift change or 2 shift changes. So that means you'll have maybe more than one team of labor and delivery nurses providing you with clinical care. Nurses are hospital employees. And so while they definitely do fulfill patient advocacy roles, they also have other things that are important and necessary to them. They have to satisfy their employer. They have to, be mindful about what their colleagues need, what their team, what their team's interests are. So in contrast, the primary responsibility of an independent doula, so a doula who's not employed by a hospital, is their client, is the person who's giving birth. The doula is there for you and your birthing companion during labor and childbirth. They won't need to leave the room and go to see another birthing person because they're going to be there with you throughout this process. They're not going to need to leave the room for long stretches of time to do charting or, to get ready for a shift change, to give the other incoming doula, a heads up, because there's not typically going to be one. Their primary focus is just supporting you during labor and birth. So I've said all of these things about the differences. And while the roles of a doula and a labor nurse are very distinct from one another, something that's really important to remember is that labor and delivery nurses and doulas are typically united in the goal of enhancing people's health and well-being during birth. Despite having this sort of shared goal broadly, there can be friction. And this can happen if nurses aren't sure about what a doula is, if they don't know about the types of support that a person would like to receive from their doula versus from the labor and delivery nurses. Sometimes nurses might feel that a doula is overstepping. This could be correct or an incorrect assessment. And they could be maybe feel frustrated, this doula is going to interfere with me being able to do my nursing care. So there's some places where friction can arise, but in general, labor and delivery nurses have a lot of experience with doulas. And a lot of labor and delivery nurses, this is just both like anecdotal, but also demonstrated in the research, have really positive attitudes towards doulas. And they really value what they bring to the birth room, what they bring to, like this general team of people who are trying to support a person through birth, each bringing their skill set, each bringing, their knowledge, their expertise, and their particular role, to play here. So educating health workers about what doulas are, what they do, facilitating clear communication and clear expectations around who's going to be doing what can help reduce potential sources of conflict and promote better teamwork between doulas and nurses. In general, though, ideally, everybody's on the same team, right? They're working towards the same goal, which is helping people give birth in a safe manner where their needs and bodily autonomy are respected and cared for. So that's a place where I think doulas and nurses have a lot in common. And so while they are distinct roles and there's lots of differences between the two, that's, I think a common goal, a common belief that's shared between these types of professionals.
And I think it's improved since I started EBB 12 years ago in 2012. At the time, I think most doulas felt like they were not respected, that they were seen as a nuisance. And in the past decade, at least in the United States and some parts of the country, I've seen a huge improvement anecdotally of doulas feeling better and nurses feeling better about the whole doula-nurse relationship and partnership. But there are parts of the world where doulas still very much are on the fringes, on the margins. They are looked down upon. They are seen as a nuisance because they're interfering with the, quick, efficient ways of caring for patients that a hospital has decided. And doulas can get in the way in terms of they could stand between you and obstetric violence occasionally. Not always are able to do that, but sometimes they can or do. And in those situations in a hospital where it's not labeled as obstetric violence, it's just this is how we do things. So I think there's definitely much like globally, and we talk more about obstetric violence in the article. So go to ebbirth.com/doulas and you can read the section about the doula's role in preventing obstetric violence and kind of the complexities and intricacies with that. So I just want to point out that it's very much location dependent, depends where you live in terms of how doulas are perceived.
No, absolutely. I think that's really important to emphasize. So, depending on your area, if there's a lot of doulas, nurses, doctors at your local hospital might be very familiar with them. But if you're in a place where there might be the only doula in the entire state or the entire region, or maybe even one of a handful in the entire country, it can be a very different experience for sure. So, another question I had for you, Rebecca, was why are doulas so effective? Like, is there a way of kind of bringing all of these ideas together that helps explain why this is?
Yeah. So when I first drafted this article more than a decade ago, my brain was really turning the wheels in my head because I was like, how do doulas lead to lower C-section rates and better APGAR scores for babies? Like, what exactly is going on? So I kind of sketched out what I call a conceptual framework, which is something that researchers use when we're trying to understand how something is happening. And so you can find that in the article. It's a graphic. It's something that we give people permission to use all the time in other materials. And it's called the Doula Conceptual Framework by Evidence-Based Birth. And so you have the continuous labor support, which we've already described. I'm going to tell you some of the things that having this continuous labor support from a doula does. One of the things we haven't mentioned yet is it increases your own natural oxytocin. Oxytocin is sometimes called the love hormone. It's also the hormone that helps facilitate labor contractions. So there is research that shows that the presence of a doula, their care, their concern, their eye contact, when they hold your hand, when they rub your back, that increases your oxytocin and helps labor move more quickly, which we've talked about is an outcome as well. They also are experts at helping you increase your mobility. So you're going to be moving around or changing positions, and doulas are constantly improving their education and their skills on the movements that help facilitate labor, depending on what position the baby is in. They increase your self-esteem, they help decrease your pain, and they help decrease your anxiety. So all of these things can help shorten labor. They decrease your need for pain medication. So you're having fewer interventions that can slow down labor as well. And as a result, you don't need extra interventions to speed up labor. You're less likely to need Pitocin, for example, because you're less likely to need an epidural and because you're moving around and you have higher oxytocin levels. So there's all of these things that kind of combine together to lead to a decreased risk of cesarean, better outcomes for the baby because labor has gone more smoothly and with less interventions. And in the end, you have higher satisfaction as well, not only because of all of these medical factors, but because you felt cared for the whole time. So I think it's really interesting. We talk about sometimes people think the word intervention has bad connotations. But in the world of research, an intervention just means you are intervening. And in this case, we are intervening by putting a skilled, trained person there to care for you and to center your needs, who also has a lot of knowledge about the process of birth. And I think it's really cool that it's such a complex thing. Like a human being can be an intervention. You bring this one person onto your team and they do all of these things to influence your birth. I just think it's incredible. And I have so much respect for the doulas out there who do this work. It's not an easy job. And they bring their whole selves to these births. They really are using their self as a therapeutic intervention, which is just really cool how human beings can be so effective.
No, it's amazing. And again, I think it just speaks, while it changes through time, humans have just a long history of supporting each other in birth, and we do it cross-culturally and cross-time, and maybe we come up with new ways or different labels for it. But I always just really appreciate that, it kind of it connects us together in such a important way. And we can appreciate it in all these different contexts, including appreciating it through a research lens and seeing what we know this feels good, but what is it going on? So
Yeah.
it's really cool that we can experience these benefits and experience knowing about them just all across the board.
Yeah. And I think for so long, people didn't understand the importance of labor support and the complexities of what a doula or labor companion can bring to birth. So hopefully this article can continue to shed light on the importance of meeting these needs. And I was curious, Sara, is there any other new research findings you want to highlight about the benefits of doulas or the roles that they play?
Yeah, absolutely. So as we were digging into the more recent research, because there hasn't been a big randomized controlled trial or Cochrane review in a while, we had an opportunity to kind of take a look at different more recent research around the benefits of doulas, particularly for supporting birthing people of color and the LGBTQ plus community. So one study that we looked at was a 2022 analysis of responses from the 2018 Listening to Mothers in California survey. And these researchers looked at nearly 2,000 responses from women who took part of this 2018 survey. And they found that women of color, as well as women who received Medi-Cal insurance, who reported having a doula present with them during birth, were more likely to report experiencing respectful care during labor and childbirth compared to those who did not have a doula present. And that really underscores the importance of having doulas who can relate to the lived experience, the whole person who's giving birth. So maybe someone who shares the same racial identity as you, who speaks your language, who comes from the same community. Their presence is vitally important. They can understand and connect with you, your needs, your concerns, particularly in a context where obstetric racism can have these sort of negative downstream consequences for the health and well-being of birthing people of color. It's just really vitally important to have doulas who can connect to people across all different like axes of identity, and the research really supports that. And we were able to cite a number of different studies, and that was a really exciting thing to include in this update. Another thing that we got to do was talk a little bit more about the experiences of birthing people who are members of the LGBTQI plus community. So lesbian, gay, bisexual, trans, queer, intersex. Because this is a community of people who may have unique pathways into pregnancy and childbirth and have unique needs during birth and postpartum care. So all health providers and all birth workers, including doulas, need to and should be educating themselves about how to best support LGBTQI plus and queer and gender diverse families in pregnancy and childbirth. It was exciting for us to be able to highlight the work that some doula training organizations are doing in providing this education and providing this grounding for birth professionals. And I think we were able to highlight the work of birthing advocacy doula trainings because they're trying to promote a really inclusive approach to doula support in childbirth and to create trainings that, help address the needs of diverse families. In addition to, and there's just a couple other different studies that were really interesting about different communities of birthing people and their use of things like birth centers, doulas, midwives that we were able to include. There needs to be more research for sure, but it was nice to be able to introduce this element as well. Finally, one more thing we were able to add to our article, and something that's really close to my heart, is to look at global issues that are faced by doulas, because there's doulas who are active across the world. And while the research hasn't always kept up with what doulas are doing in different countries and different communities, we wanted to just highlight the work that's being done, how doulas are transforming birth care in a variety of settings, how doulas in different countries are kind of transforming what it means to be a doula in particular cultural and social contexts, and how they're, through that work, they're transforming how people are giving birth. And at the end of our article, we included some resources about how to find a doula, as well as links to EBB podcasts with doulas practicing outside of, or just practicing all around the world.
I think that is something the reviewers have told us as well, that one of the main changes to this article is it has more of a global perspective. So we were really excited that you and Yehotu contributed to that. And another thing you contributed, Sara, is you thought it would be helpful to have a table about guidelines and from medical and midwifery organizations and whether or not they support doula presence. So can you talk about that?
Yeah, absolutely. I think it's really interesting to consider for those of us who are giving birth in hospital-based settings, what are the professional guidelines that might be might be the basis for the types of care we're receiving or the types of training that some of our providers are getting. So for this article, we looked at recommendations from the American College of Obstetricians and Gynecologists in the United States, the American College of Nurse Midwives, National Institute for Health and Care Excellence in the UK, and the Royal Australian and New Zealand College of Obstetricians and Gynecologists. And all four of these professional bodies recommend that birthing people have birth companions of their choice present at birth. And three of them, the two in the United States, ACOG and ACNM, as well as the National Institute for Health and Care Excellence in the UK, in particular recognize doulas as providing a known benefit to birthing people, and were supportive of their presence in birthing spaces because of the benefits they can confer for people who are giving birth. I know in updating the article, we've really built on a strong foundation, and we've been able to talk about a lot of those changes. But Rebecca, what is the bottom line about the evidence on doulas?
Great question. I love a good bottom line. My first bottom line is go to ebbirth.com/doulas and download the one-page handout because it has a really nice one-page summary of all this evidence. In more detail, I want to say that evidence shows that continuous labor support is one of the most important and basic and foundational needs of birthing families. And evidence clearly shows that a doula's presence can improve birth outcomes. It lowers the chances of needing a cesarean. Doulas lower the need that you may have for medications for pain relief. and they can lower the risk of newborns experiencing a low 5-minute APGAR score. Doulas also improve your satisfaction with birth, and they provide an important source of physical, emotional, informational, and advocacy support for both the birthing person and their chosen birth partners. Doulas are not clinical professionals, but their value in making childbirth safer and more supported has been recognized by leading medical professional organizations, as you mentioned. Research has not shown any medical risks to having a doula. However, I do have a quick caveat to that. There may be some potential drawbacks, which we discuss more in depth in the article. If the birthing person has expectations of advocacy that their doula is not able to fulfill. So go to the article to learn more about advocacy expectations. In addition, when working with any professional in any field, there is a risk that the person you hire might not fulfill their obligations to you or might not be the right fit for you and your family. Doulas are a diverse group. They have a wide range of perspectives on, skills, and approaches to birth. And not every doula is the best fit for every birthing family. And we encourage people to meet with several before you decide on the final person, if possible. Likewise, doulas may decline to work with a client who has expectations that they cannot fulfill, who behaves towards them in an appropriate manner, or who is dishonest to them. So before any doula or client signs an agreement, we believe it's important for them both to have gone over their expectations and approaches to birth and have a mutual understanding and communication. We also know that doulas are trained to provide support during labor, but they actually do so much more. They engage in wide range of forms of care and support. Some doulas care for people during the conception journey, through abortions, during and after miscarriage, in the weeks after childbirth, and at the end stages of life. And there's so many different kinds of trainings, certifications, traditions, perspectives on doula care. Research has really confirmed what we already knew and what a lot of families know. Doulas can make a big difference in your birth experience, but having a doula is not a magic wand. So doulas often work in broken healthcare systems in the face of oppression, racism, homophobia, transphobia, and other isms. And doulas need all of us to support them in advocating publicly for safer, more supportive birth settings. The doula's role can also be made more difficult if you and your birth partner have limited knowledge about birth options when you go into labor. So educating yourself about birth as much as possible beforehand can really help equip you with skills that can be combined with the doula's support. We know we have people who listen to this podcast who are thinking about becoming a doula. If that is you, it's important to consider what types of training you want to pursue and what your own approach to birth work may be. And it's also important to recognize that this can be a demanding field where you may be exposed to challenging situations and traumatic births. So seeking out community support from other doulas can help you process difficult emotions and avoid burnout. But in conclusion, we believe that the evidence shows that doulas provide important benefits for clients, birthing families, entire communities, as well as for hospitals and medical systems. Therefore, doulas should be viewed and valued both by parents and providers as valuable evidence-based members of the birth care team. So that wraps up the article. I did want to let you know again that you can go to ebbirth.com/doulas to learn more, get more in-depth info about all these topics we covered today. Look at our list of resources. We have tons of lists for you, lists of different interviews, lists of interview questions, that one-page handout that's really helpful to download. All of the scientific references, we link to them at the bottom of the article. And there's a list of directories as well to find doulas. So overall, we hope that you get a lot of help out of this information being published and that you share it widely so that more people can also learn about the benefits of doulas. Sara, any final words from you?
No, it was just I always enjoy contributing to the signature articles and getting to do the deep dive into the research. And, really it was fun working with you and with Ahotu on this article. And yeah, I owe a lot personally, professionally to the different types of care that I've received from doulas, even, as a researcher. And it was really gratifying to be able to use the research, use the evidence to talk about, the importance of the work that they do.
Yeah. If you're listening to this and you're a doula, we appreciate you, and you are valued. You are evidence-based. Hopefully you already knew that, but it's sometimes nice to have that affirmation of like, yes, you are doing great work. So thanks everyone for listening, and we'll see you next week. Bye.
Bye.
Today's podcast was brought to you by the Evidence-Based Birth Professional Membership. The free articles and podcasts we provide to the public are supported by our professional membership program at Evidence-Based Birth. Our members are professionals in the childbirth field who are committed to being change agents in their community. Professional members at EBB get access to continuing education courses with up to 23 contact hours, live monthly training sessions, an exclusive library of printer-friendly PDFs to share with your clients, and a supportive community for asking questions and sharing challenges, struggles, and success stories. We offer monthly and annual plans, as well as scholarships for students and for people of color. To learn more, visit ebbirth.com/membership.